Good morning, everybody, here in DC, or good afternoon in the Netherlands. I hope the sound is okay. Let me start by saying that I'm delighted to join you today for the Holland on the Hill webinar on pandemic preparedness. Well, we all know after the last 18 months the impact of the pandemic on our public life, on our work, on schools, on our private life. It has been huge, and it became abundantly clear, I would say, that we need to improve our structural health crisis preparedness to reduce the impact of public life and thereby also the economic fallout of the pandemic. Now, COVID-19, of course, put the pandemic preparedness on the forefront of the policy agenda. And as a topic that requires public-private cooperation as well as international cooperation, it is only appropriate, I would say, that we tackle it as a part of our Holland on the Hill program. Most of you will know it, but let me briefly explain. Holland on the Hill is a joint effort of the US Congressional Caucus of the Kingdom of the Netherlands, the embassy here, the corporate partners, and the Netherlands America Foundation. With whom we will have a gala dinner tonight, and I'm very much looking forward to that event as well, because gradually we are going back to normal. By organizing these kind of webinars, we bring together experts, we bring together staffers, members of the diplomatic community, the private sector, stakeholders, to discuss a policy subject that is relevant to both the United States and the Netherlands. And before the pandemic, as I mentioned earlier, these webinars took place in person, on Capitol Hill, but I'm glad that we, for the time being, can still continue talking with each other in cyberspace, but I'm looking forward to meet you all in person again as well. I've not seen him yet, but I hope he's there because I'm very proud and pleased with the participation of Congressman John Molenaar of Michigan, who's a member of the Dutch caucus, who will be with us today. I look forward, John, to your remarks on our partnership. And today we will hear more about the need for construction practices that, in addition to sustainability and energy efficiency, also focus on healthy buildings. We will explore the possible contribution of technologies such as UV and air filtration that reduce the indoor health risk. And we will hear about the innovative concepts on pandemic preparedness for cities, including public spaces, transportation, etc., etc. And of course, we will hear about the role of standards, guidelines, and public communication. Now, this kind of innovative collaboration between the United States and the Netherlands started, of course, well before COVID-19. But the pandemic has shown even more how we need to focus on this kind of collaborative innovation. And I hope that this webinar will be an inspiration for strengthening this collaboration. We will first turn, I think, to Congressman Molenaar for his opening remarks. After that, we will hear from Lizzie Bons-Nobre, our former colleague at the Foreign Ministry and now Deputy Director International Affairs at the Netherlands Ministry of Health, Welfare and Sport. And then I think our moderator, Lawrence Sloan, who is the CEO of the American Industrial Hygiene Association, will introduce the panel and kick off the discussion. So thank you very much for giving me the opportunity to open the webinar, and I'm very much looking forward to a great discussion.
Hi everyone, I'm John Molenaar. I represent Michigan's 4th Congressional District, right in the middle of Michigan's Lower Peninsula. It has about 700,000 people, and the major industries are manufacturing, tourism, and agriculture, with more than 10,000 farms. My grandfather immigrated from the Kingdom of the Netherlands, worked as a migrant laborer, and eventually started his own farm in the state of Indiana. His son, my father, became a chemist and moved to Midland, Michigan, where I grew up and live today with my family. While I don't know if my grandfather ever dreamed his grandson would one day be elected to Congress, it has been a privilege to work with Holland on the Hill and reconnect with my ancestral homeland in a meaningful way. I've missed the events and the opportunities to share time together with Holland on the Hill during this past year and a half. And I'm sorry I couldn't join you today for today's live event. The pandemic has taught us many lessons, and now it's up to us to take those lessons and turn them into meaningful changes that will prepare us for the next time something like this happens so we can help save lives. One of the biggest problems last year was it took too long to ramp up production of ventilators, PPE, and other materials that were needed to keep people safe. So now we know that we need to have more of those items made domestically, while also having more secure supply chains with allies we know and trust like the Netherlands. We also know that public-private partnerships are vital for everything from producing PPE and ventilators to Operation Warp Speed for vaccines, to supporting small businesses like we did in the US with the Paycheck Protection Program. It's my hope that in the future, there will be more collaboration between companies in the US and the Netherlands, just as we saw between Pfizer and the German company BioNTech. There may also be more lessons yet to learn from this pandemic. We need a thorough investigation and an independent investigation into how this virus began. And if it came from a lab, we need to decide whether or not that research should continue and how we can make research labs safer so something like this never happens again. I know our two countries have prospered together in good times and bad, and things always are better when we work together. I know the Netherlands and its people have a lot of scientific knowledge and experience to help the world recover from this pandemic and protect against the next one. Thank you for participating in today's Health Crisis Preparedness webinar and for your interest in strengthening the alliance between our two great nations.
Dear Ambassador, dear guests, good morning to you all. It's a pleasure to speak to you virtually from The Hague. Although I must mention that as of today, travelers from the US are again welcome to travel to the Netherlands without testing or quarantine requirements. I therefore hope that next to virtual webinars like these, we will be able to have face-to-face meetings again soon. Just a couple of months ago, this was, however, almost unimaginable. Both the US and the Netherlands were in a completely different stage of the pandemic. Hospitals under stress, economy shut down, intercontinental travel nearly impossible. COVID challenged our resilience, the resilience of our healthcare systems, of our economies, of our societies. And even though we struggled, we eventually, with the help of many, tackled the crisis and bent the curve of this pandemic. This wasn't a small achievement, especially in open societies like ours. There will be fierce debate, diverging opinions between countries, how to best address the pandemic. But for me, one thing is certain, tackling the pandemic wasn't something that governments could have achieved alone. The pandemic showed clearly how effective cooperation between governments, the private sector and academia can be. Let's, for example, look at the developments of vaccines. Private international companies worked tirelessly to develop and scale up manufacturing around the globe. Governments stepping up to finance and ensure effective regulation, the international science community delivering the core building blocks for the development of vaccines. Within the Netherlands, this cooperation is known as the quadruple helix. It refers to the cooperation between companies, knowledge institutions, citizens, and government to create better outcomes. It is the driving force behind the Dutch life sciences and health approach. And more personally, I think this tight-knit public-private partnership is one of the core elements of Dutch society. Coming to an end, I want to make a reference to the first World Local Production Forum that is taking place this week. This forum discusses global challenges in promoting local production to improve access to health products and technologies. The Dutch Minister of Health, Hugo de Jonge, will provide the closing remarks for this event tomorrow. The coming year is committed to play an active role in promoting preventive instruments for future pandemics, like stimulating local production and supporting a healthier public space. And I believe public-private cooperation is key to make this a success. I'm therefore very happy that the Holland on the Hill partners choose pandemic preparedness and economic resilience as the theme for the meeting today, and that we have such an excellent panel. Thank you very much.
Thank you, Lizzie, very much. And hello, everybody. My name is Larry Sloan, and I am the CEO of AIHA, which is a scientific society representing the profession of occupational and environmental health and safety. And I'm honored to be serving as your moderator for today's program. So before I introduce our panelists, I'd like to say a few remarks to help set the stage. Number one, the current pandemic has really thrust our society into a new reality that will change how we view the role of public health. Two, the lessons that we've learned about how to mitigate the spread of SARS-CoV-2 are directly impacting how we address the public's demand now for clean indoor air, what we refer to as the built environment. Number three, the evolution of knowledge that will help us improve the quality of clean indoor air is paramount. It's a critical part of how building owners and managers will address the risk mitigation for occupants and visitors to these spaces. Four, while I'm sure all of us would love to quote unquote get back to normal, the reality is that the aftermath of this pandemic is going to require significant investment and attention to engineering controls, which previously might not have been of much of concern or regard to folks. Five, we don't know what the next pandemic or crisis is going to look like. It could be another biological pandemic, or it could be, God forbid, a terrorist incident. So we need to build upon the lessons that we've learned from this one. And finally, with respect to crises, let's not forget that we are experiencing a major one, and that is the burgeoning impact of climate change. As of right now, look at the record-breaking heat that the Western United States is currently experiencing, and the impact it has on wildfires that obviously have a serious impact on indoor air quality. And even after the fires have subsided, the products of combustion linger in the air, and they affect the health and safety of those that reside in homes in those communities. So all of this is going to require all of our nations together to be more resilient in how we approach public health, how we safeguard our communities, and how do we ensure that our supply chains remain flexible. So with all that being said, I have the distinct honor and pleasure of introducing our 5 distinguished panelists. First, Stephen Martin. Captain Martin is a senior research engineer officer in the Commissioned Corps of the U.S. Public Health Service, assigned to the Field Services Branch of the Respiratory Health Division at the National Institute for Occupational Safety and Health, commonly known as NIOSH, located in Morgantown, West Virginia. Next, we have Mr. Benjamin Heckman, who is a principal and co-founder of RHP Risk Management. He has more than 20 years of experience as an industrial hygienist and environmental consultant, managing both occupational and non-occupational risks to human health. Next, we have Pete Dirk. Mr. Dirk works for Occupants as the global leader for resilience and water management. He has 35 years of work experience across 5 continents in the area of water management and climate. Next, we have Nitin Tyagi. Mr. Tyagi has 15 years of work experience in the lighting industry. Currently, he leads the UV marketing initiative for a company called Signify here in North America, and he is segment manager for the retail and hospitality vertical. And finally, Mr. Adhishesh Sood. Mr. Sood is the Strategic Alliances Leader for Healthy Buildings at Honeywell Building Technologies. His experience ranges from airport, airside management to occupant health and well-being in buildings. So welcome to our 5 panelists. We're going to start with specific questions to each of the 5 panelists one by one. And I'm going to start with Mr. Martin. Captain Martin, let's start with you. In your opinion, what are key lessons to be learned from the COVID-19 pandemic in terms of preparedness, and how do you see the future of the pandemic preparedness playing out?
Well, thanks, Larry. I guess before I say anything more, I want to make it clear that while I do work for CDC NIOSH, I'm an expert in ventilation systems and other engineering controls. So I'll be speaking today solely from that perspective. I am not an expert in larger pandemic preparedness or government policy issues, and those decisions are made at levels much higher than mine. Also, if I happen to say something today that's inconsistent with published CDC policy, that is solely my mistake. I'm not sitting here in front of you today to create or announce any new policies or guidance from CDC. With that out of the way, I think the obvious lesson that everybody's learned is that we could have been better prepared for COVID-19. At the same time, we say that to ourselves after every disease, pandemic, or disaster that impacts our lives. Yet we learn something from every one of them, and we improve our preparedness a little bit each time. I take a lot of comfort in knowing that we have many ventilation engineering control tools that can be quite effective at preventing the spread of disease through the air. We simply need to be in a better position to implement those tools quickly when they are needed the next time. And that's really where I see the focus being as we take what we've learned and the experiences we've endured through the COVID-19 pandemic, and we get ready for the next one. I think there's going to be a lot of emphasis put on ensuring buildings are meeting code minimum ventilation requirements. I think that includes bringing older buildings up to current code, even if they still legally meet the code in existence at the time they were built. Simply meeting code minimum outdoor airflow requirements is a fantastic first step toward preparedness, because you're not scrambling to get to that point once the next pandemic is upon us. I also think we'll see efforts made to update ventilation design standards and guidance to include equipment and capabilities and ventilation systems that will help protect building occupants under pandemic conditions. So these additions to ventilation systems may not be necessarily required under normal operations, but at least they'll be there in a time of need. I also expect there to be some significant work put into improving or replacing HVAC systems and equipment, particularly in older buildings. Related to that, I think efforts will focus on developing building-specific or even HVAC system-specific plans to increase outdoor airflow rates, total ventilation rates, and enhance air cleaning in central HVAC systems or with supplemental air cleaners. And we're going to see significant research and standards development in the area of air cleaner performance, particularly when it comes to many of the emerging technologies that have exploded onto the market since the beginning of the pandemic. We need to have a better understanding of how these devices work, their ability to clean the air under real world conditions, and their safety for building or room occupants. And if they do prove to be safe and effective, then we'll be much better equipped to include them in tools to help building owners and operators layer various air cleaning technologies on top of enhanced ventilation strategies to meet their overall goals. Some of the things that I mentioned are already getting underway here in the United States and organizations like ASHRAE. I have to imagine that REVA in Europe is focused on the same things. But ultimately, I think I see a collective push to develop more useful information on the effectiveness of different ventilation schemes and other engineering controls under pandemic conditions. And this will allow governmental agencies like CDC and trade organizations like ASHRAE to make better, more specific recommendations in the future. It will also help the individual consumer better understand how these controls work, which ones should be considered, how to implement them properly, and how to layer them on top of others to ultimately protect their buildings, their friends, and their families.
Very good. Thank you very much, Captain Martin. Next up, we have Ben Heckman. The question for you, Ben, is what are some lessons that we've learned from the pandemic regarding the evolution of knowledge that specific to risks that have been encountered during this pandemic?
Thanks, Larry. Great question. I think it's important as a public health scientist to understand that science evolves and there is a need for societal acceptance and recognition of this change, that this does occur, and act accordingly in a timely manner to address those risks that is the evolution of science. It's also important to identify authoritative organizations that can provide scientific updates and learn to leverage your expertise or partner with organizations that can broaden your group's expertise and knowledge base and understand those risks, which then can lead to more resiliency. Thanks.
Okay, thank you. Next question is for Pete Dirk. Pete, is our urban infrastructure ready for the next health crisis? And how can we improve the public infrastructure to be better prepared either for another pandemic crisis or the impact of climate change?
Yeah, great question, Larry, thanks. Well, there's certainly room for improvement. I think we have noticed that all. We all saw how almost immediately our public transport came under pressure. It was experienced as not safe by the public, and our trains, our subway systems, our airports. it was not a safe situation for those that had to work there, but also for the passengers. And these passengers are the people that have to keep our cities running, of course. These are the people that work on our public infrastructure, our public utilities like water supply, waste management, electricity. I think we all learned how valuable these utilities are, more than we ever thought. We also learned how valuable the people are that work there and how vulnerable these people are. So how easily we can disrupt our own system. Also, of course, the staff for our hospitals had to travel via this public transportation. And we saw that our hospitals had problems with accessibility. It was also an area that was not felt as a safe area. You saw how hospitals started improvising with tents and air sluices and separated, contaminated areas. A lot of improvisation that you should translate, I think, now into better solutions for the future. And we saw, of course, pressure on our public space. Once the pandemic was there, we all needed to stretch our legs every now and then. And we found out how small our parks are sometimes when we need to stretch our legs all together, when we all want to sit out in that sun. I think the good thing that we learned is, that's another type of infra, is digital infra. That's also infra. We quickly discovered how good we are in working from home. I think much better than everybody has ever experienced. And that's the one big takeaway from this crisis, of course. And looking forward now, how can we improve? We will all work more from home. We will work more digital, and our digital systems will even improve. We will also see more micro-mobility, more individual transportation. You see it in cities like New York and Amsterdam, Paris, London, everywhere. You see more people take the bike. The bike business is a good business to enter now, I think, in these cities. But with that micro-mobility comes the need, of course, for bike lanes, for transportation access, for new parking spots, for connection to public transportation. So there comes a number of questions with that. That means also less, we have seen less cars because people work from home, but we will also see more cars now. People start driving again because the car is all of a sudden discovered as a safety device, perfect for driving to your vaccination location or to your test location. And the Netherlands, at a certain point, there were even shops and supermarkets that required you to come by car to enter the facility. So the car as a new safety device, who had ever thought of that? We'll have more green spaces. I think we should make that green space more multifunctional to serve for different purposes, also because we don't know what the next crisis will be. And basically you can say everything I said so far is also good for climate change. It is good to have green space, less cars, more bikes, etc. Climate change and pandemic resilience working on both really go hand in hand there. And maybe a last word on hospitals. Just remember how things have changed. It's not so long ago that we used to build our hospitals on islands. Just imagine Roosevelt Island, Ellis Island, because we were afraid of pandemics. So for quarantine reasons, we built those hospitals there. Then those hospitals got flooded and we decided to build them somewhere else. And so you see how things return and how we sometimes make the mistake that we prepare for the previous event instead of for the next disaster to happen. We don't know what the next one is, which unfortunately means that we have to prepare for the unexpected. I'll leave it here. Back to you.
Very good, Pete. Very informative and thought-provoking comments. All right, next up, we're going to get specific about technology. This question is for Nitin Tyagi. Nitin, what is germicidal UV, and how did the pandemic accelerate its use in creating safer indoor spaces?
Yeah, thanks, Larry. I think talking about the fundamentals of the technology here, very clearly the germicidal UV is the shorter wavelength of the light spectrum referred to as ultraviolet, which is proven to have effectiveness in inactivating all kinds of microorganisms, be it virus, bacteria, molds, fungi, and so on. And to be a little more specific, within the UV band, we specifically talk about a specific spectrum of light which varies between the 200 to 280 nanometer wavelength, which is referred to as UVC. And that particular band is proven to have the highest photochemical energy and has proven to be the most efficient and effective spectrum of light to inactivate all kinds of molds and viruses. So when this band is put to use to provide disinfection solutions, this traditionally refers to as germicidal UVC or germicidal UV as we call it. I think more interestingly, the question that you asked with respect to pandemic, and I was listening to the panelist earlier. Very clearly, this pandemic has brought to the surface the need to have infrastructure and preparedness to address these kind of solutions. And clearly, acceleration in a technology happens when there is a need that emerges in the market to which can be readily addressed by the technology. UVC as a technology is not a new invention. It has been there for decades. If I talk about Signify as an organization ourselves, we have been in this technology for more than 55 years. So clearly the technology has been there, has been put to use for decades. There is enough evidence of that. But what has really changed is that prior to the pandemic, this technology was being put to use for specific applications. Applications like hospitals, applications like water purification, which is a big application for UVC, and those kind of specific needs which were being addressed by this technology. What the pandemic has done is brought to the surface the need to have an effective, efficient solution which can be put to wider applications in mass market to provide effective disinfection solutions. And that is where the acceleration of this technology has happened. And I think acceleration has happened at both ends, manufacturers coming out with wider range of products, solutions to address the need. And we've also seen a lot of action happening in terms of regulations and guidelines coming from standardization authorities, talking about UVC to ensure that the technology can be put to use not only in a safe manner, but also ensure effectiveness. Just as an example, UL came out with a guideline last year talking about the 8802, talking about the product certification requirements around UVC products, which can be put to wider applications. We see organizations like Stephen was talking about, ASHRAE talking about ventilation systems. They already had a handbook talking about UVC as part of the ventilation system and is now trying to even give better guidance on use of UVC for air disinfection. You also have agencies like IES and coming out with guidelines talking about how to put UVC in the space. And very recently, even CDC coming out with a paper talking about how this technology works and how it can be put to effective use to provide disinfection solution. So clearly because of the pandemic, the need to have a solution which can be put to mass market and wider applications has triggered this development. A lot of regulation guidelines coming around towards the use of this technology. So that's how I believe this technology preparedness for not just for today, but also for the future when we talk about improving our buildings and ventilation systems will play a major role going forward.
Very good. In a previous life, I actually sold UV systems for wastewater treatment. So I am familiar with the technology from the water side of things. So very, very efficient way to disinfect wastewater prior to discharge. Okay, very good. Thank you, sir. Next up, we have Adhishesh. Question for you is, how do we create a space where occupants want to work? And again, what lessons are we drawing from this pandemic?
So thank you, Larry. Let me try and answer that in the reverse order. I think from a lessons standpoint, I'm actually glad I'm at the end, because I think we've covered so many lessons during all the panelists when they introduced themselves and the stuff that they said. But I think one of the major things that we've seen is the digital transformation and the adoption of software in the industry. Just the amount of data that's been generated, just the amount of research that's been done in the past year, I think it trumps whatever we've done in the past 10 years. Maybe we've got this whole trigger about health, well-being, concentration on how we need to move away from just the building itself, but also to the people that inhabit those buildings, just to make sure that we look at occupant experience and occupant well-being as the prime focus when we go back to work, or we make sure that when people start to come back to offices, for example. And I think that kind of creates a segue into how we create a space where people actually want to work and come back, right? So I think what I believe is it's not a technology that's going to drive people coming back or wanting to work. I think it's a combination and integration of stuff like air quality, right? Whether your ventilation strategies are in place, whether you have UVC disinfection in place to make sure that people feel that kind of confidence coming back, whether you have filtration, which is, to the prescribed limits by ASHRAE, for example, or CDC for that matter, or whether the lighting in a building is proper or ambient, right? Whether can you see on your cell phone, can you see whether the heat map of a building or occupancy is optimum for you to go back and start kind of collaborating more in conference rooms again, or make sure that you're comfortable going back. So I think from that perspective, technology companies need to come up with an experience rather than just handling individual line items of occupant experience, and making sure that these are interconnected so that the data that's being driven out of smart buildings currently is able to kind of capture what occupant experience looks like, and then translate that into a confident atmosphere to work for everybody.
Very good. Thank you very much for those comments. We're going to move to some group questions now, and I've got 5 of them. And then following the group questions, we'll see what kind of questions are coming in from the audience. So for each of the questions, let me give the panelists a heads up, because we did a little bit of homework and we agreed on which panelists are going to answer which question. So this first question is potentially to be answered by Stephen, Ben, and Nitin. And so be prepared. So the question is, number 1, how can we install confidence, trust, and transparency about risk reduction measures such as these air cleaning devices? And where should the average consumer get his or her information on the safety and effectiveness of these types of engineering solutions? So who would like to take this question first? Or I'll call on people if that's easier. Ben, you look like you're ready to speak. Okay, go ahead, Ben.
Thanks, Larry.
Yep.
I think it's important, as Stephen mentioned earlier, for the public-private partnership to look to authoritative agencies like CDC and ASHRAE, and to some degree OSHA, or some of the emergency temporary standards in other states that are beginning to define more quantitative standards that are helpful in understanding what are the thresholds that should be used in buildings for better air quality. Examples are air changes per hour, or the clean air delivery rate for a particular building, or even the acknowledgement that the germicidal UV radiation is effective. I think understanding that and leveraging that to look to qualified authoritative agencies is really where that begins. And then for new and emerging technologies, it's important to understand how they work in as-built conditions. Those studies and independent agencies, whether it's government, authoritative agencies, or even academic institutions that have vetted those technologies and help consumers or organizations understand that those are effective, proven technologies.
Very good. Thank you, Ben. Could I call on Stephen to go next?
Sure. Simply, I think we have to honestly educate people, on how these devices work. And to do that, we need a bulk of scientific evidence to back up our messaging. When it comes to air cleaning devices, there are decades of evidence proving that mechanical air filtration is effective at removing airborne particles. And when I say mechanical air filtration, I mean things like typical ventilation filters, or HEPA filters, or even filter materials used in respirators. A huge body of evidence showing that those are effective. As we heard, there's also a substantial body of evidence going back decades to support the use of classical germicidal ultraviolet energy for in-duct and upper room air disinfection, and even surface disinfection. But there are these handful of emerging technologies that have been heavily marketed during the pandemic, and many manufacturers and resellers of these devices are making extremely impressive claims when it comes to effectiveness and safety. And I think it's confusing the public to some degree. And I think all of us here today would agree that we hope these devices are as safe and as effective as the claims. However, that bulk of scientific evidence is simply not there yet. So neither governmental agencies like CDC or EPA, or respected trade organizations like ASHRAE are able to fully embrace the use of these technologies at this point. But in the end, the burden of making a decision to purchase and use any air cleaning device is on the consumer. And as it stands today, consumers have a choice to make. They can choose a device that uses a proven technology, like HEPA filtration or ultraviolet energy, or they can choose a device that uses a newer, less understood technology. And if they make that choice, then they have some more homework to do. Luckily, CDC and ASHRAE and other organizations, AIHA, ACGIH, They all have guidance to help consumers with that decision. And we urge consumers to exercise caution and research the technologies to learn how they work, what the limitations might be, and whether there are potential safety issues, particularly with people having underlying health conditions. As Ben said, they should request testing data that quantitatively demonstrates a clear protective benefit, occupant safety under conditions consistent with use. A lot of these devices have been tested in the lab, but the lab results just simply can't be scaled up to real-world use. Any unsubstantiated claims of performance or limited studies on a device should be questioned by the consumer. At the same time, if the manufacturer can provide solid evidence that a device is safely effective, then the device should be considered for use. As the scientific community learns more about these technologies, there will certainly be a more obvious conclusion about each of them in the future. However, we also know that the next new technology is likely just around the corner, so it's sort of a never-ending cycle that we have to deal with.
Very good, thank you. And Nitin, would you like to wrap up this question?
Yeah, I think both Ben and Stephen have really summed it up really nicely. Very clearly the need to trust regulatory authorities is absolutely there. I think that's the first go-to for an average consumer, to simply look at the product and the solution and see if it is being recommended or certified with the relevant industry standard, both at the product level, and there are enough guidelines and available from an application level as well. And I think I fully agree with what Stephen said in terms of the claims being backed up by scientific evidence. I think the average consumer should also take one step deeper, not just looking at the manufacturer claim on the packaging of the box or so on and so forth, but take a step deeper to understand what that claim has been substantiated with from a scientific community. So I think both these things put together should give enough information, enough guidance to an average consumer to make the right choice.
Yeah, and I can say that AIHA has been besieged by numerous vendors that have been promoting different technologies to clean and purify the air. It's unbelievable. So it is a very confusing marketplace, and it's very important for the consumer to do their homework. Thank you all very much. So the next question is targeted at Stephen, Ben, Pete, and Adhishesh. So be prepared. So the question number 2 is, what are the primary drivers for improving pandemic preparedness and reducing risk? Regulatory, such as CDC or OSHA, or non-regulatory, economic benefits, liability, comfort, and well-being. Are those important drivers, or are there other drivers to consider? So let's start with you, Pete.
Well, I think obviously economics will come first by almost everybody. We have seen the devastating impact on our economies of this crisis. Now everybody wants to recover as fast as possible, and nobody wants such a crisis again. But I think to make sure that we are well prepared next time, we should also make sure we have our regulatory drivers in place. Otherwise, people will start forgetting about that. We need to set the bar high. I'll just give you one example of a really high bar. In the Netherlands, after the major flood we had in 1953 that killed 2,000 people, we said never again, never again. And we translated that into a flood protection safety standard of 1 in 10,000 years. And you can hardly imagine how high that is compared to the 100-year flood protection in the US. But the Netherlands thought we really needed it, was half of the country below sea level. And because we had that regulatory instrument in place, we did it. So we have that system now, and we also maintain that system at that level. And that really helps. So I would say it's a bit of both. And then thirdly, it's a lot about psychology and perception, public awareness. It's about panic, and it's about reputation. It's all at the same time. And it's obvious that our leaders, our politicians, and others also have to keep that in mind when they take their decisions on this point.
Very good. All right, let's go to Adhishesh next. Would you like to add any further insights to this question?
Yeah, I concur with Pete, of course. The economics is extremely important. From a pandemic response perspective, the economies are starting to recover. And we've seen the devastating effect on specific industries like aviation, for example, right? Air traffic's down by 95%. It's wreaked havoc everywhere. But I think it's moving towards the curve of being reputational and liability and well-being as well, the points that you mentioned, Larry. Because I think from like I said, from an occupant standpoint, it also means that when people come back and we actually have normal circumstances again, it's the responsibility of offices and organizations or countries for that matter to make sure that they remain safe in the future as well. So while you future-proofed from a pandemic response perspective and you've kind of, you're trying to curb those primary drivers, I think it's going to move towards the other part of the spectrum as well. However, I think the regulatory bodies are, they keep us in check. They've got the verification of the validation methods of us going back. Technology companies like us, for example, who can refer back to them and say, okay, this is not something that operates in the limits of what we think. It's also to these regulatory authorities who've done enough scientific research and evidence behind it, and hence we can prepare better. So I think it's a mix of both.
Very good. Thank you very much, sir. Next up, let's go to Ben.
Thanks, Larry. I would agree with Ashish and Pete that I think as science evolves, I think the drivers also have evolved during this pandemic. Initially, I think there were health and fear and economic drivers because of the devastation that occurred in those two drivers. And then it really moves, I think, more towards a recognition and a need or an awareness within the public that there's a need or an awareness of public health and air or clean air as a driver, from a public health standpoint. And I do think there are regulatory drivers that are kind of lagging, but are being developed. And I again come back to, I think we need more quantitative standards versus qualitative that help building owners and the public understand what is acceptable and what drives what is really called relative risk reduction with the proven technologies. So I think it evolves, and there is an awareness going forward that this pandemic, unfortunately, I don't think is the last event that'll happen like this. And now there's a need for engineering technologies. It's something that's ranked within what I do, which is called the hierarchy of controls, which is at the top of that system, and it really builds in more long-term controls that are important versus what would be at the bottom of that system, which is more administrative controls or wearing cloth face mask. I think it's important to have solutions that are holistic or are better at controlling those risks. And I think that's sort of the extent of the answer.
That's the layered risk concept. You don't want to just do one thing. You want to try to do multiple things to mitigate the risk.
Yes.
You're good. Okay, let's, Stephen, would you like to wrap up this question?
Yeah, sure. First I'll admit this question is just a bit out of my wheelhouse, but I'm going to disagree a little bit with Pete. And I think, or maybe I hope, that the ultimate driver for future pandemic preparedness is the desire to ultimately protect human well-being. Secondary drivers after that, and economics is certainly going to be a big one. I think will be mainly associated with continuity of operations. Can my facility stay open as it is? What steps do we need to take to protect people? Will my employees or customers feel safe enough to enter the building? Can life continue on as normal? These types of questions. Then I think the other drivers you mentioned come into play with order depending on the individual circumstances and the audience that we're talking about. An important driver for one entity may be a lesser priority for another. But the important thing is that everyone works together to learn as much as we can about protective technologies. Governmental agencies try to base guidance on the best available scientific evidence and proven technologies and work practices. These guidance recommendations cannot be based on theories or single small experiments. They need to be born out of tried and true precedent. And I think that's really where the public and private sectors have an opportunity and a responsibility to work collaboratively. They need to generate solid scientific foundations, identifying effective proven technologies and demonstrating their effectiveness under real world conditions. And once we do that, then government agencies can use that information to inform the public and prepare for the next pandemic the best we can.
Very good, thank you. Those on the line may be familiar. I was just thinking about this as you were responding to the question. There's an organization called the International Well Building Institute. And we spoke with them a couple months ago about what is the meat behind this particular standard that they're promulgating. They've gotten some very, very famous celebrities that have been on YouTube and even on TV talking about how great the standard is. And so we're trying to understand, what is the standard? and who are the practitioners and the professionals that are going to help to enforce the quality of this particular standard, right? There's a lot of flash right now. And so, the occupational environmental health and safety profession, we feel, plays a major role in making sure that if the building is going to try to comply with this well building standard, that there's some meat behind the premise, if you will. So there's a lot of activity in these informal standards that are being pushed out into the marketplace right now. And I think we're going to see more of them in the months and years ahead. Okay, very good. So the next question is designed specifically for Pete. So the question is, what do you think the US can learn from the Netherlands and vice versa on pandemic preparedness and resilience in general? And what opportunities do you see for exchange and collaboration?
Yeah, definitely a lot of opportunity, I think, for exchange. And basically, you could say it already started here today now, so I'm very happy to be part of that. I would say a lesson that we all have to learn in general is we should not just try to become more resilient, to be better prepared. We also have to be more sustainable, because sustainability is key. If we have put less pressure on our natural systems, and just imagine where this virus came from. If we do less depend on the resources that are so precious, if we can rely on shorter supply chains and more local productions, all these things make us less vulnerable. And the less vulnerable we are, the more resilient we are. That's definitely one thing we have. And also we, of course, make it a better planet to live on for all of us. Having said that, lesson to learn from the Dutch, obvious, the bikes, in addition to the windmills, the cheese, the wooden shoes and the tulips, every Dutchman rides a bike. We have more bikes than people in our country. Of course, we have a small and a flat country, I know that, but still there's a lot to learn there. When it comes to micromobility, we can really step more out of that car. And in addition to our public transportation systems that we should also make safe and solid, we can get back to that car. The other one is robust infrastructure and utilities. We saw how much we had to rely on them, and we need to understand it's not about investing in new projects and stations and whatever. It is also in continuing to invest in operation and maintenance of your critical infrastructure, and also in operating it in the most proper way. And that's really something that we need to invest in. Finally, blue and green spaces, the image from the Netherlands. There's a lot of blue-green space. We're preparing for climate change, but we can also be better prepared for pandemic. So we have to rethink our city centers. Maybe we also will get some more space in our city centers now for more blue-green infrastructure. Now, what the Dutch can learn from the Americans, I would say first and for all, individual resilience. You guys are much more resilient on an individual or on a family level than the Dutch are. The Dutch have a government that takes care of so many of those issues, or if the government doesn't take care of it, there's an insurance for it. And that makes people sometimes a bit lazy about their own resilience. And I think resiliency starts from the individual, and that's really a key value, I think, for the Americans still. We were all also amazed about the absolute no-nonsense vaccination program, the speed, how it goes, creativity in offering burgers and beer and whatever, while the Dutch are continuously negotiating how can we find out who's really the next one to be vaccinated. And we have long discussions on that instead of simply just vaccinate everybody. I think the warp speed, how that went in the US still amazes the Dutch. And finally, basically referring to my first point, resilience in general, you're better in it than you think you are, because the US understands that you cannot be prepared for every crisis or every natural disaster along your borders and inside your country every day, while the Dutch really try to exclude every risk. You understand that there might be a hurricane, there could be a wildfire, or there could be a pandemic that you could not prepare for, and then you have to take it from there. And I think that's an aspect of resilience that is also essential. Resilience is not only about prevention, it is also about knowing what to do in case it happens. And I think if we combine our best forces here, the Dutch and the Americans, you get a pretty good comprehensive approach, I would say. Back to you, Larry.
Very good. Yeah, I definitely think the two cultures and mentalities complement each other very well. And I think, by nature of the vastness of the United States and the you know, the miles and miles of borders, and of course the natural disasters that plague every part of this country, we've had to be resilient. We've had to be resourceful because you never know what we're going to be hit with in any given month of the year. So very good. Thank you very much, Pete. Okay, next question is designed for Ben. And the question is, what steps do you think are required at the federal level here in the United States for improving the pandemic preparedness? And what's the role of what we call the private-public partnerships, such as urban infrastructure and resilience, and then just the role of science and standards?
Yeah, I think it comes back to some of the parts of answers that I've said before. I think it's important at the federal level for the agencies that are regulating or providing guidance for, you know, in this case, infectious disease preparedness or the next pandemic, is really to assess what is effective and provide quantitative guidelines that provide, you know, the important relative risk reduction within buildings. And it comes back to that concept of engineering controls, and that way it removes variables around mask wearing or, you know, other variables that are at the personal level or the individual level within an organization, and having that higher level of engineering controls being driven by the federal government or authoritative agencies, I think is important. And I think understanding, you know, and communicating, I think there's an education portion that's important to that, is helping building owners or organizations understanding what those levels are, what those thresholds are, and what those quantitative guidelines could and how they would protect building occupants. As far as the other part, the role of science and standards, I think that's really an important part. You know, as a public health scientist, there is foundational science that is there, that proven technologies do work to prevent infectious disease and reduce risk within the buildings. I think they are important for people to be educated on and understand. And as well, there's an important part that I mentioned in the first response is science does evolve. That's the natural part of science. We started this pandemic with an understanding, or you know, it was a novel coronavirus. It was new. There was a lack of understanding that people were initially concerned about fomite risk, which is a transmission risk from surfaces. It evolved into a close contact or potentially, you know, less than 6 feet droplet kind of a risk. And now we realize that the concern and the reality is it's much more of an aerosol transmission risk, you know, long distances in buildings that more than likely have bad ventilation or poor ventilation that is of concern. And that is the process of science. It evolves. I think people need to understand that, and those regulations in science need to evolve with that and help us be more resilient with that understanding.
Very good. And I was actually just going to mention the fact that there's been such an evolution in the thinking about cleaning and disinfection and all the what you call hygiene theater, right? All the fogging of indoor spaces and subway systems in New York, you know, that was televised for many months at the beginning of the pandemic, and how really ineffective and unnecessary a lot of this cleaning is to help mitigate the risk. And the whole issue of the fine particle aerosol transmission, it's been an evolution in the thinking of WHO and CDC and others to say that the really small particles, they really do make a difference. And they're really a critical disease vector in this overall pandemic. So there's been definitely an evolution. But you know, the general public really doesn't understand that science evolves. They think that if something was said a year ago, it's set in stone. And when they see an evolution in the science and the thinking of the dynamic, they get, you know, confused. And then they say, well, you guys don't know what you're doing, but we're learning as we go along. And that's the challenge in how we communicate as scientists to the general public. Things do change as we learn more. So thank you very much, Ben.
You're welcome.
Last question for the group, and then we do have a couple questions that have come in through the Q&A portal. And I want to remind the attendees, if you have a question, please don't hesitate to post it in the Q&A tab, and we'll get to all your questions as to the best of our ability. So the last group question is targeted at Nitin and at Hishesh, and that question is, in the workplace, how do we ensure that certification parameters are not only met, but that an optimum level of performance is achieved at all times so we can maximize human health as well as guarantee productivity and performance? So let's start with Nitin for this particular question.
Yeah, thanks, Larry. I think maybe I'll I'll refer to the opening remarks that Adishesh made earlier, talking about integration of technology and the need to have platforms which can not only ensure that these technologies come together to provide an optimum solution, but at the same time, these technologies, we also have a platform which can give the consumer the visibility of the effectiveness and the fact that these solutions can work in the manner they're supposed to work over a period of time. So really talking about the fact that you have technology platforms which can integrate all of these technologies together and bring it on one platform which provides that visibility. Having said that, I think one of the key important parameters is also the fact that the application design done to start off the installation or to start off the project is one of the vital elements to ensure a continued optimum performance of the system. So I think adequate application knowledge, going to the professionals who know the stuff, going to getting the application designed through a professional channel and ensuring that it is designed to a level which is optimized, coupled with the integration of technology, having a platform which allows you to monitor these technologies together and take corrective actions as you go along. I think both of these things to put together should provide the level of performance that is needed in any space.
Very good. Thank you very much, Nitin. Adishesh, do you have anything further you'd like to add?
Yeah, I think to what Nitin just said, I think the most important fact is that we continuously ask this question to ourselves, right? Is the environment clean? Is it safe? Is it ready for business continuity, etc.? I think there's a continuous cycle of first assessing as to what your building's current state is, benchmark it against certification standards, against the regulations, for example, that come from the CDC or ASHRAE, etc. Make an informed decision for what your healthy, what a healthy building looks like, or what are the improvements that you should make. On the second stage, you act upon it. You say, I'm really going to go ahead and make my building more healthier and more productive. Improve indoor environment, make sure that I maximize comfort and minimize health risk around it. And then eventually assure the occupants, assure facility managers, for example, that yes, this is going to allow easy and confident, reopening, continued operation. We make sure that there's continuous commissioning around this whole thing, because that's what leads to improved well-being. It's a continuous cycle that keeps going of assessing, acting, and assuring, which kind of lays down all the parameters have been met or not. I think that's extremely important.
And I think how we as building owners and managers communicate to the occupants of that space in very clear terms, this is what is being done in your building, and this is the benefit to you as the occupant. Yeah. So really being able to convey it in terms that the public understands, which is sometimes easier said than done. Okay, so I'm going to switch over to some questions that have come across the portal here, and I'm going to leave this up to you as to which you would like to answer. So the first question is, it's a little bit of a long one, so let me read through it. The question comes from James Garza, and he asks, has anyone reviewed Dr. Han F's 1956 study, which is titled Air Electricity Against Bacteria for Healthy Room Climate and Well-Being? That's the name of the study. It says here that his study sets up a baseline for improving HVAC systems to help fight pathogens in the air and on surfaces, electrostatics in the environment, and how they may affect health and productivity. Anybody familiar with that particular study would want to comment?
I mean, I'm not familiar with the study itself, but the point that that's mentioned about baselining improving HVAC systems to combat pathogens in the air and surfaces, I think that's well known, and that's commonplace knowledge, I would say, in today's world. How your ventilation strategy affects the aerosols in the air, right? For example, we know that there is a certain amount of particles which are released with every activity. While you're talking, while you're coughing, while you're sneezing, there's microns and volume of particles that are released in the air. Now, how you combat that with whether you've got HEPA air purification, or you've got filtration, which is MERV 13, for example, or you've got UVC in your duct work, that's a different story altogether. And those are the kind of things which are coming to surface now with the advent of this pandemic. So I think yes, there's a lot of research that dates back to a lot of years back, but to the point that's been made on this panel specifically, I think there's been so much evolution around it. And so much of scientific research that's already gone into it. I think a baseline is already established from an HVAC standpoint. And I think there's more research being done on how to combat pathogens because we now understand this much better. So not familiar with the study, but I think the basics are pretty much there.
Okay. Anybody else?
Yeah.
I think I would just add, Larry, that I think the concept that's being covered by the group is really important with regard to reducing risk. And it's really the testing, verification, and validation against proven technologies or against certain, regulatory or authoritative guidelines. And I think that's an important concept for people to take away is that, that methodology or process is very important to help reduce risk.
Very good. Okay. Next question is a little more general, and the question is posed, can the panelists talk about infection control efforts being put into place in hospitals post-pandemic? Is there a role for hospitals, the government, and companies to collaborate in this space? So who would like to kick this one off?
I mean, I'll take a stab at it. I mean, I think, yes, definitely there needs to be some collaboration between, all those organizations, government, individual hospitals, stakeholders, regulators, and I think some of that's happening, especially in the healthcare field. There's a lot of after action evaluations of our current pandemic experience happening. They're asking themselves what worked, what didn't, what paradigms need to be reevaluated. And there's no doubt that changes will result from that. Within the hospital design community, they're already discussing how to incorporate protective design capacity for pandemics in a prevention through design approach, where future protection capacity is already built into the hospital design. An example of that is what can be built into a standard patient room that allows it to quickly be converted into an isolation room or even an intensive care patient room. So we have the ability to enhance surge capacity in a safe and effective way. And that's great for hospitals that will be designed under the new standard, but I think that will extend to existing hospitals. What changes can they make? What simple design strategies can they adjust to help give them that ability to increase surge capacity during the next pandemic or whatever the event happens to be.
Very good. Thank you, Stephen.
Just an additional comment to what Stephen just said. I think UVC has been discussed at length on this particular panel of late. I think what is also important is that tuberculosis and UVC go way back. Since the 1970s, I think healthcare always had upper air UVC being installed from a germicidal disinfection standpoint. I think that's taken forefront. There's a lot of healthcare and a lot of hospitals which have been talking about upper air UVC, or let's say UVC for that matter in ducts. So I think that's going to be I'm not saying it's going to become a design norm or a parameter per se, but I think it's going to be more rampant than it used to be earlier. So I think just a little bit, yeah.
Okay. Anybody else? Ben?
Yeah, I would also just add, I think that is accurate as Stephen has touched on. I think there's lessons to be learned in infection controls in hospitals and how they're looking at, based on my experience, how these techniques and technologies can be used to help them prepare going forward, the negative pressure isolation rooms in hospitals, or how they can change rooms to meet those needs, as well as I think the technology within the healthcare space is being used to look at how those type of controls or those type of technologies are more effective in commercial spaces or other things that are non-healthcare. I think is an important lesson to learn across those two different industries as it moved into public spaces and commercial.
Thank you, Ben. Anybody else?
And maybe just my 2 cents on it. I think the fact that we've realized during the pandemic that it's not only important to provide these adequate infection control measures such as UVC in specific zones in an application area such as in hospital. I think these applications will now spread to other areas as well, realizing the fact that in a case of a pandemic this would be widespread and is easily transmissible. You will see these application areas such as common areas in a hospital, cafeterias, you look at corridors and those kind of areas where typically you would not have these kind of products or technologies being put to use. I think those areas will need to expand and will need to ensure that there is a comprehensive and complete infectious control solution being put in place.
Very good. Thank you, Nitin. Okay, let's move on to the next question. This one is an interesting one. It has to do with vaccinations. How can the private sector work with regulatory agencies to help influence their employees to get the vaccinations to help to prevent the spread of the contagious diseases? This continues to be a significant issue in the workplace for many employers. So who would like to kick this one off? How do we get employers to start or to get promoting the vaccine to their employees?
I'll just start with a brief answer, Larry.
Okay.
I think it's really it's based on education, and I think that's an important piece of, unfortunately, where we are today in the United States with the vaccines. But I think there have been other examples of the polio vaccines and how that was done in a different way that I think was more effective or more accepted in our country. And I think it really starts with education and risk communication as a foundation. And I think more needs to be done on that aspect to improve vaccination rates.
Very good. Pete, I'm curious, and if you don't mind my picking on you, in the Netherlands, I understand that in Europe there's a broader anti-vaccination movement than here in the United States. And have you had to deal with that over in the Netherlands with respect to folks that are just fearful of any vaccine?
Yeah, we have definitely very strong discussions on that point. There's not so much that you can say there's a percentage of the population that is not interested. It is about very specific groups that do not want to vaccinate. For instance, immigrant groups that lack information because of language problems, but also because they're often informed by the channels that are not the public health channels, the regular channels in the Netherlands, but it can be information from their home country or via, in another way, via their religious channel or whatever. So, the problem is, those that vaccinate the least are the ones that are most vulnerable in most cases. Living in small homes with lots of people, 3-4 generations, etc., etc. So that's one group. The other group is the religious groups. There's a significant group of people in the Netherlands, what we call the Bible Belt, that has been against vaccinations, not only now, but also in the past. And that's something that we have to deal with. It's part of our cultural system that we have. And a third, pretty new, there's of course a group of people now that we did not recognize before that simply are in denial of whatever, the virus, the seriousness of the disease, the impact of the vaccinations, the true belief that a healthy mental state or a healthy living style is good enough. More yoga helps more than your vaccination. So it means that you have to reach out to all of these groups separately, more or less, and have a tailor-made approach where you cannot impose anything from the outside, but the only thing that really helps is leadership within those groups that is willing to take the message and bring it out. Community leadership really from within is the one thing that really helps here. But I think we really need it, because otherwise you're fooling yourself when you say we have a 70 or a 75% vaccination ratio, because within specific groups, that ratio can be so low that you will always have new infections starting from there. So I guess this is more or less comparable to what you experience in the US right now.
Absolutely. Thank you very much. Anybody else want to comment on this question before we move to the next one?
So I think just a small comment here, Larry. I think it's just picking up a string from what Pete just said. I think it's very cultural, right? So for example, at Honeywell, it's the leadership direction that we get a panel of doctors to speak to our employees saying vaccination is important, for example, or we have public-private partnerships where we actually turned the Bank of America Stadium into a vaccination center, and we help deploy technology. So I think it's a lot to do with what the organizational culture is, and that's helped volumes of people at Honeywell, at least. A majority of us have gotten vaccinated just from the awareness that we could spread through the initiatives that were taken at our place.
Yeah, it really is important to get those influencers in these particular groups that are resistant to the vaccine, to get them to understand from these thought leaders, these folks that are well regarded in these particular sectors, to to understand and really get to the science of it. there's an incredible amount of misunderstanding still about the vaccines. It is amazing what we hear played out in the media here in the United States. So, okay, next question is Congress is currently working on an infrastructure improvement bill, as we all know. And the question is, what would the panelists like to see included from a healthy building perspective? Who would like to kick this one off?
I mean, I can take a stab at it.
Okay.
So we work quite deeply with the International Wellbeing Institute, for example, and we know that there's a lot of those parameters from the standard itself which have been included, as policy, for example. I wouldn't say that they've been ingrained into the bill for that matter, but there's so much of that language that goes in when these things are being discussed. I think from a panelist standpoint, air and ventilation, air quality and ventilation strategy, I think that's extremely important to move away even from just indoor air quality to indoor environmental quality, which includes not only air, but also lighting, water quality, etc., etc. I think that's extremely important. If those kind of things are ingrained into whatever we're doing from a country standpoint, I think that takes care of human beings to a large extent, not just the atmosphere inside them. So I think that's something that I would like to see.
Yeah, AIHA published a couple guidance documents last year during the pandemic about the fact that, these buildings that have been shut down for many months, you've got water systems that are stagnant, right?
Yeah.
Because you've got the opportunity for mold and Legionella, if you will, to be circulating through the water system. So the process in which these buildings are being recommissioned and opened up, you've got to be mindful of these mundane issues that have been percolating behind the scenes. And that's a really good point, Ahishesh. It's not just the air quality. It is the lighting, it is the water system, it's the creature comforts within the space itself, ergonomics, of course, the way people are situated at their workstations. So it really is a broader, more holistic picture. Yeah. Any other questions or I'm sorry, any other comments about this question about what you'd like to see in this infrastructure improvement bill?
I maybe have one additional remark when it comes to healthy buildings. Let's not forget, the question is also, which buildings are we talking about? Because we may see a change here, we may see a transformation. A lot of the buildings will not have the same functionality as they had before the pandemic. I think our real estate investors know that in their central business districts, a lot of things will change. So what do we do with that transformation? How can we use that transformation when buildings move over to another use, or maybe to a more mixed use, or to a more whatever type of change? Maybe use that moment of change also to make the buildings healthier at the same time. And that's definitely one. The other one is we will also, the buildings that we keep on using, we will use in a different way. We will not go that much to our offices anymore, for instance, which means that we can now diversify the use of space. Do we really need all those working spaces where people sit behind their desk from 9 to 5? Or are we going to rethink that use in a more creative way of making it more a meeting place where people get together to brainstorm and to maybe celebrate that their colleagues together? And what does that mean for that healthy space again, when it comes to ventilation or keeping 6 or 5 feet of difference, etc. So I think we should not try to apply these ideas on healthy buildings on every building the way we see at these buildings now. There will be a gigantic transformation. Unfortunately, also with an evaporation of billions of dollars for the real estate market, I'm afraid. So it will be interesting to see where that will catch up and pick up again and turn it into a new revenue generator as well. Hopefully using the opportunities that are offered here as well.
There are dozens of commercial buildings here in the Washington, D.C. area that are being converted into residential. I live in a community in Alexandria, and there are 3 buildings that were office space, and they're now converting them into high-end lease apartments. And so AIHA, we're going to be relocating our offices next year. We're consolidating our space by 50%, and we're going to be following what they call the hoteling concept. So for those that are teleworking 4 or 5 days a week, you reserve a space. If you need to come into the office, we'll have community spaces and more what we call huddle rooms, right? Small spaces for folks to get together for departmental meetings. But it really is an evolution in how we view these commercial space. Any other comments about this question on the infrastructure bill?
No, I think just a quick thread to what's been put on the panel, talking about the fact that we need to be prepared for the future and not just look at where we are today. So I think from that aspect, I think it's very important to not only talk about the fundamentals of the certification and the regulations that we have today, but also look at emerging technologies and also look at emerging aspects of health and safety within a space. And I think it will be really helpful when the policy is talked about from creating that infrastructure. These technologies are also referred, so that the average consumer can get some guidance in terms of what can be potentially put into practice and what is effective, what is not. So from that perspective, I think that would really help.
Very good. Thank you, Nitin. Just a reminder, we've got about 10 minutes left. I've got about 11:46 here on my clock, Eastern Time, US. If anybody has any questions, please put them in the Q&A box, and we will get to that question as quickly as we can. So let's see. I don't see any other new questions, so I'm actually going to go back to some questions that each of you submitted prior to this webinar, and I'm going to pick on a couple of you in the interest of keeping things moving. So let me start with Captain Martin. You had submitted a question that I'm going to ask you to address, and the question is, in the short term, how could the average consumer know whether a specific device works as promised? Again, where do they turn to, and what do you think the role is of NIOSH in all of this?
It's a hard question because there's so much information out there from these various devices, and for the consumer, the waters are very muddied at this point in time. And I sort of go back to what I said earlier. From the very beginning, CDC has sort of had an FAQ dealing with these new devices and what information that consumers need to focus on, the questions that they need to ask, the homework that they need to do, the information that they need to get to make an informed decision. CDC is not going to recommend for or against the use of any device, but we want consumers to make informed decisions. And with some of these devices now, I think if the consumers do their homework, the conclusion should be pretty obvious for them. And if that's the case, then maybe they should just look at some of the more proven technologies and go that route. ASHRAE similarly has guidance where they sort of follow the CDC NIOSH path. Actually, they post the CDC NIOSH statement or FAQ on their website as well. Just encouraging consumers to do their homework and not get caught up in the claims, but really get the information and see how that information relates to the way that devices are going to be used in their real world. And if they're convinced, then go for it. If they're not, then question that and look somewhere else.
Okay, very good. Thank you very much, Stephen. Next question, I'm going to turn it over to Nitin. And the question here is, how do you see the use of UVC technology as part of an integral solution to risk reduction? In other words, how do you approach the interplay with other technologies as part of a more comprehensive or holistic strategy to reduce the risk in indoor spaces?
Right, I think that's a very important consideration at this point in time. I think we, as a technology platform, I think all these technologies that we talked about on this panel today, we're talking about indoor air quality, talking about HVAC, ventilation system, controls and monitoring technologies, which can ensure that the performance is monitored over time. All of these have to be integrated and brought to a platform and work in conjunction. I think one of the important elements of this story is also the fact that there are a lot of building and indoor spaces out there which already have an existing system in place. And those systems today, for example, even the ventilation systems today, most of them are designed keeping in mind the comfort of the occupants in that space, not necessarily trying to design those spaces to achieve the highest level or the most optimized level to prevent infections and spread of air-to-air transmission. So I think what needs to happen is that from a UVC standpoint, I think this is where this technology can really contribute, working in conjunction with those existing infrastructures, which is already in place, is to really enhance the effectiveness of these systems by putting an additional piece of technology in the space to ensure that it's not only comfortable to be in and be productive to be in, but it's also safer to be in from an infection and from a ear-to-ear transmission. So I think that's where the UVC adds value, working with these technologies, working within existing infrastructures to enhance the overall safety of the space.
Okay, very good, Nitin. Again, just one final reminder, if you have a question, please put it in the Q&A box and we will get to it quickly. All right, let's see, we've got another 6 or 7 minutes left, so let me flip over to Ben. And Ben, we've talked about regulatory drivers and, you've mentioned, the need for companies implementing engineering controls. From a science and public communication perspective, why do you believe that, again, testing, verification, and validation of engineering controls is so important?
I think there's an important awareness and recognition that has evolved that people, employees, organizations desire clean air, given what has happened with the pandemic. And I think there's an important aspect of the need to use methods that either assess initially, based on what Nitin has said, how is the building performing today? What needs to be done? And then be transparent in the solutions that you may use to then verify that the technology you're putting in is effective, validating that it's working, and kind of back to the need for that is obviously having a healthy workspace, but really I think there's an uncertainty within the public and employees, the need to instill confidence as people return to work. I think there is certainly a concern. Hopefully, I was encouraged by things that were happening, but with things like variants that have more disease potential or more morbidity or more mortality, there's still a concern. There is still a pandemic occurring, and I think people are still concerned. So there's a need to ensure that it's working, making good decisions from an investment standpoint, that you are truly reducing risk. And I think that only really happens with the testing, the verification, and the validation. And I think all those things are important from a transparency perspective to really ensure and instill confidence in your workforce and your employees that you do have safe air, because I think that, and healthy air, because I think that's an important outcome that has evolved from this pandemic.
Very good. Thank you, Ben. All right, I'm going to flip over now to Pete. Pete, the question is, what about public spaces, things like parks and waterfronts and town squares? Why are these spaces so important from a public health and health crisis preparedness perspective?
Yeah, as I already stated before, they are all relevant for two reasons. The one reason is they help us to adapt to the impacts of climate change, because it allows us to store more water from frequent rainfall, and it will also reduce the urban heat effect in our cities. And on the other hand, it will create that space that we need so desperately in case of a pandemic, where we will be confined again within our cities and within our small living areas, where we'll have to stay indoors for a lot of time and only will get out every now and then. People simply need space to stretch their legs, to relax, to sport, or to just sit outdoor. So that need, I think, is only increasing. And what I like to emphasize is, I on purpose mentioned climate change here again, because let's not forget, that's the crisis already coming that we know. Other pandemics or other resilient risks, we're not sure. We might be hit by a meteorite or not, or a volcanic eruption. But one thing is sure, we are already in a climate crisis, and that crisis is getting bigger by the day. And it will be also a pandemic crisis, because those are interrelated. And we really have to keep our eyes on the ball here. That's why I'm really happy with the program that is now launched in the US. We really need, there's no way back. We need to adapt. We need to protect ourselves, but we also need to step up our efforts to reduce the climate change that is ongoing now. And there's a saying well known by a famous American who said, pandemic, very bad, but at least we have a vaccine against it now. against climate change, there is no vaccine. We'll have to solve that together.
Very good. Thank you very much, Pete. Okay, last question for Adhishesh, and we'll close out with this one because this is kind of a holistic question. And the question is, how are productivity and performance a direct linkage to occupant health and well-being? And I know you've sort of touched upon this before, just kind of to bring it home, what's the linkage between the two?
I think a direct linkage, Larry. So what it means is, if you look at all the parameters that we spoke about on this panel, right? Air quality, UVC, lighting, whatever that may be, is targeted towards the occupant, like I've always been saying. However, I think just going a level deeper, if you look at the problems that we are tackling today, we see it as whether we double our ventilation rates or not, for example, right? And what effect does it have on this particular occupant? However, if we think about not the building, but also about the fact that the occupants' increased productivity adds not only to the company's bottom line, but also, lesser number of sick days. We move away from the sick building syndrome. You mentioned Legionella, and we overcome the split incentives that exist currently in buildings. For example, real estate owners versus tenants are going to have a different line of sight and a different reason for a particular thing, or they're going to have a different incentive for implementing a particular strategy. So I think it's very important to overcome that. And then, as soon as you get more productivity from a particular employee and you get more performance, even extending it to the fact that, for example, lighting improves patient recovery in healthcare, right? So it's not only limited to just performance and productivity, but I think to a lot of other segments that we can also look at. I think there is an absolute direct linkage from a health and well-being perspective.
Very good. We just got one more question. I think we've got time for it. This one might be designed to be answered by Nitin. Question is, are any insights or discussions regarding the use and public exposure to far UV? Far UV. Would you like to comment on that, Nitin?
Yeah, absolutely. I think that's clearly one of the emerging technologies, if I may call it that way. It's still part of the UVC spectrum, but a little shorter wavelength. It's typically referred to as 222 nanometers. It's an emerging technology. At least at this point in time, from a commercial use or from a mass market application perspective, I think the applications are pretty limited. But there is still evolving regulations and standards around this technology at this point in time. So, but clearly a very promising solution from the fact that yes, it can be deployed in a space and still you can have human presence even with direct exposure, and you would not have a safety concern from that perspective. But I would still say early days in terms of commercialization and in terms of mass application of this technology at this point. So hopefully something that will be brought to the market or brought to the foray in future.
Very good. All right. Well, listen, we are out of time, so I want to thank all of you for your insights, for your commentary. I appreciate it. Thank you to all the attendees, and thank you to the Embassy of the Netherlands for hosting this program. I hope everybody has a good rest of the day and a very safe and healthy summer season ahead. So thank you very much for your participation, and goodbye.
Thank you, Larry. Thank you so much.
Thank you. Thanks, everyone. Thanks, Larry.
Thanks, everyone.